the United States could save lives and money by implementing universal health care as opposed to the current privatized, profit-driven system. Would you agree that there's a moral and fiscal responsibility to do so? Many of you work in the healthcare field and have seen the detrimental effects caused by patients waiting too long to seek care due to the potential financial burden of accessing healthcare. Whether it's diabetes patients using insulin sparingly and ending up hospitalized, or a patient with nagging back pain who opted for a chiropractor rather than seeking medical help, now finding out the pain was caused by cancer that's now metastasized. Our current healthcare system has been counterproductive to sustaining a healthy population. The downfalls of our privatized healthcare system affects all of us, and we shouldn't have to wait until we're directly impacted to act and seek a better alternative. As a registered nurse who has worked in 2 hospitals, a rehab, and an outpatient group home setting, I've seen firsthand the detriments of the profit-driven healthcare system in the US. While the examples I used of patients with diabetes and cancer are anecdotal, they are real, and just a glimpse into how healthcare costs and access to healthcare are necessary in maintaining health. Universal healthcare, or Medicare for All, is a policy idea and movement to ensure all people in the United States have access to free healthcare provided by the government, most famously presented by former presidential candidate and Senator from Vermont, Bernie Sanders, who ran his presidential campaigns in 2016 and 2020 around the idea that in the wealthiest nation on earth, everyone should be provided with free, accessible healthcare, and that healthcare is a human right. Universal healthcare, or Medicare for All, is a policy idea advocated for by progressive politicians and advocates who believe the private health insurance industry is counterproductive to the goal of providing affordable and accessible healthcare to people in the United States. Bernie Sanders, Senator from Vermont and former 2016 and 2020 presidential candidate, is the most notable advocate of universal healthcare, with his proposition of Medicare for All, using this policy to gain support of American voters during his presidential runs. Bernie Sanders promotes change by continuously speaking about the healthcare crisis in the United States and pressuring fellow politicians to work towards universal healthcare. Medicare for All is a policy idea advocated for by progressive politicians and advocates who believe the private health insurance industry is counterproductive to the goal of providing affordable and accessible healthcare to the people in the United States. Universal healthcare would save lives. According to the prognosis of healthcare in the United States, ensuring healthcare access for all Americans would save more than 68,000 lives, or the equivalent of 1.73 million life years every year. According to universal healthcare as pandemic preparedness, the lives and costs that could have been saved during the COVID-19 pandemic, an estimated 212,000 lives, would have been saved in 2020 alone. The basic functions of government are to provide leadership, maintain order, provide public services, provide national security, provide economic security, and to provide economic assistance. Healthcare should be a public service provided by the public sector. The government already provides military, law enforcement, infrastructure, private transit, and public education. Healthcare is already publicly funded in some cases, like Medicare for people over 65 and people with disabilities. Universal healthcare would save money. According to Improving the Prognosis of Healthcare in the USA, universal healthcare would lead to 13% savings in national healthcare expenditure, the equivalent of $450 billion annually. According to universal healthcare as pandemic preparedness, the lives and costs that could have been saved during the COVID-19 pandemic equals $105.6 billion in medical expenses associated with COVID-19 hospitalizations. With privatization of health insurance comes increased administrative costs. Administrative costs with private health insurance leads to 12.4% of spending for insurance companies, compared with 2.2% under Medicare for All. Administrative costs now make up 34.2% of all healthcare expenditure in the United States. Americans pay $2,497 per capita for administrative costs alone, compared to $551 per capita in Canada. Now let me tell you about one of the most vocal advocates of universal healthcare, Senator of Vermont Bernie Sanders. Bernie Sanders, Senator of Vermont and former 2016 and 2020 presidential candidate, is the most notable advocate of universal healthcare with his proposition of Medicare for All, using this policy to gain support of American voters during his presidential runs. Bernie Sanders brought the idea of universal healthcare to the forefront of his presidential debates. In his 2016 presidential debate with candidate Hillary Clinton, he vocalized his support for universal healthcare, as well as reining in pharmaceutical profits. While he was the only candidate in 2016 touting Medicare for All, by 2020, when he ran again, he was joined by Bill de Blasio and Elizabeth Warren in advocating for Medicare for All, while 7 other Democratic candidates offered similar solutions, and 17 Democratic candidates opposed it entirely. As recently as 8 months ago, Senator Sanders uploaded a YouTube video titled Medicare for All Now, which continued his call for Medicare for All with emphasis on the COVID-19 pandemic. Sanders has spoke about expanding Medicare to cover hearing aids, dental, and vision, and discussed lowering the age of Medicare incrementally with the goal of eventually covering everyone. Universal health care in the US is not a new idea. According to satisfaction with health systems in 10 nations, the majority of Americans, 61%, prefer the Canadian system of national health insurance. In the same survey, Canadians were reported to have the least dissatisfaction with their health system. Bernie Sanders has a well-documented history of advocating for the poor and working class. A 1963 Chicago Tribune article showed an image of Bernie Sanders being arrested during a protest to force Chicago to address school segregation in the city. For context, 14 years later, in 1977, now President Joe Biden opposed desegregation, stating, "Unless we do something about this, my children are going to grow up in a jungle, the jungle being a racial jungle with tensions having built so high that's going to explode at some point." Bernie was ahead of his time, advocating for LGBTQ rights, environmental protection, healthcare for all, fair taxes on corporations, fewer military engagements abroad, more sensible drug policy, and women's reproductive rights for his run as governor in 1976, which he lost. For context, now President Joe Biden voted against same-sex marriages 20 years later in 1996, and in 1982 allowed states to restrict abortion access after the Roe v. Wade Supreme Court decision. In 1981, Sanders ran for mayor of Burlington, Vermont, and was reelected 3 times before running for Congress in 1990, reelected for 8 terms before being elected to the Senate in 2006, where he continues to serve as Senator of Vermont. Sanders is now the Senate Budget Committee Chairman, Primary Health and Retirement Security Subcommittee Chairman, as well as serving on committees for Energy and Natural Resources, Environmental and Public Works, Veterans Affairs, and Health, Education, and Labor Pensions. So you might be asking, what has he done to ensure healthcare access? Bernie Sanders promotes change by continuously speaking about the healthcare crisis in the United States and pressuring fellow politicians to work towards universal healthcare coverage. Healthcare has been a pinnacle of Sanders' career in politics. Senator Sanders, along with 14 co-sponsors in the Senate, have introduced the Medicare for All Act of 2022 to guarantee healthcare in the U.S. as a fundamental human right. The American people, he says, understand as I do that healthcare is a human right, not a privilege, and that we must end the international embarrassment of the United States being the only major country on earth that does not guarantee healthcare to all of its citizens. Senator Sanders President Joe Biden has suggested that he would veto Medicare for all and has instead called for expanding the Affordable Care Act. Sanders successfully pushed for the inclusion of $11 billion in funding for community health centers in the Affordable Care Act before it was passed in 2010. Sanders has advocated for free healthcare since his first run for governor in 1976. In his campaign announcement letter from that time, he stated, "Let us stop the war in Vietnam now and build low-cost housing, provide free and excellent medical and dental care for all, and clean up the environment." Universal health care, or Medicare for all, is a policy idea and a movement to ensure all people in the United States have access to free health care provided by the government, most famously presented by Senator Bernie Sanders from Vermont. Bernie Sanders, who ran his presidential campaigns in 2016 and 2020 around the idea that in the wealthiest nation on earth, everyone should be provided with free, accessible healthcare, and that healthcare is a human right. Universal healthcare, or Medicare for all, is the policy idea advocated for by progressive politicians alike and advocates who believe the private health insurance industry is counterproductive to the goal of providing affordable and accessible healthcare to people in the United States. Bernie Sanders, the senator from Vermont and former 2016-2020 presidential candidate, is the most notable advocate of the universal healthcare movement with his proposition of Medicare for all, using this policy to gain support of American voters during his presidential runs. Bernie Sanders has promoted change by continuously speaking about the healthcare crisis in the United States and pressuring fellow politicians to work towards universal healthcare. I'll end with a quote from Senator Sanders. "Medicare for all would not only provide coverage for every American as a right, but would save the healthcare system in our system hundreds of billions of dollars. This struggle for a healthcare system that guarantees care to all will no doubt be difficult. We're taking on some of the most powerful special interests in the world, but it's a struggle that must be fought, and together it is a struggle that we will win." Thank you for your time.